I have a great pleasure to introduce Christine and Stian. And I think that this presentation is very important, at least in two respects. One respect is, of course, the topic of medication-free treatment, and it's made possible by a law from a very democratic country. And looking at what happens when trying to follow or starting to follow a new ideas of treatment is there is a lot of curiosity of that issue. And secondly, I'm very pleased that Christine and Stian are here from the top of the world, from Tromsø, because Tromsø really was the beginning of the humanistic practice that is nowadays known as reflective processes and dialogues. Already at the 70s with Tom Andersen and, for instance, by psychiatrist Magnus Halt and other, they very consciously started to look for new ways of meeting with people in need for help in several crises in the hospital, and thereafter in founding an acute team. And their work has been very important in many respects. And for that reason, I'm very happy that you could make it possible, Christine and Stian, coming to and present your work here. So, please.
Thank you.
Yeah, thank you. Okay. Yes, we are very happy to be able to present our experience for more than 5 years of working at the medication-free treatment unit here in Tromsø. My name is Christine NYQUIST. I'm a psychologist, and I now work as the leader for the unit, and has been working here for the past, since we opened up the treatment program in 2016.
Yes. Yes, I'm Stian. Yes, I've been working here since the beginning. My title is Experience Consultant, what will mean that I've had experience with mental health problems like psychosis. So my work is, a part of the job is supporting, another part of the job is trying to find, to do some understanding of the experience that our patients have. So being in dialogue about the experience and try to make knowledge or understanding of the experience is another part of my job. And I'm a part of the leader group and have some responsibility for some of the patients. And yes, it's a very interesting and meaningful job to try to find this way, this new way with, together with our patients without medications or tapering down from medications. Yes, so interesting job, and nice to be here talking to you. I've been in Warszawa 1 year and in Torgny 1 year on the conference, so I like it here with you. So yes.
It's been very interesting to follow the open day today. Me and Stian has been watching throughout the day, and we're happy that we have the chance to present some of what we're working on now.
Yes.
All right, so what you said, Stian, about finding a way, finding new path, I think maybe that says something about what we want to talk about this hour, because when the medication-free treatment unit was established in 2016, it came from ideas from the user organizations and people who worked in the hospital or in the hospital system, and I think that finding a path away together has been very central since then. Me and Stian, we have planned to today talk a little bit about what the history of the unit that we work in, and what happens here, who are the people who come here as patients,
Yes.
and also some thoughts about the biologic processes that happens here.
Yes.
Yeah.
That's right.
That's right.
That's right. Yes.
And what we talked about before, Stian, is that we would like, if anyone has questions, feel free to
Yes.
ask or to write in the chat.
Yeah.
And we will try to do our best to answer whatever.
Yes.
Yeah.
We do.
Should we try and slide?
We can.
Yeah.
I can do it.
You can.
I'm good at this.
Yeah, you're good.
Yeah. So.
There you go. Yeah. So should I start off?
Yes. Do that.
Yeah. As Jakob said, we are on top of the world and a little small city in the most northern part of Norway. We're in the land of the northern lights, and the sun is up all night in the summertime. We will want to start off with telling you a little bit about the history of the unit that is established in Tromsø. And it started off in 2015 when the Ministry of Health and Care Service in Norway sent out a document, a law, which they asked all the regional trusts in Norway to establish their own medical-free units. The demand from the ministry came, among other things, after that several different user organizations for years had joined forces in a collaboration they call the Joint Action for Medication-Free Treatment. In Norwegian it's Fellesaksjon. And the goal for this collaboration was to establish real medication-free treatment alternatives to be available from public specialist health services, and especially for people with what's called severe mental illnesses.
Yes.
Mm-hmm. And the user organizations in Norway, they explained what they have experienced as patients, and they and in this explanation, it was established that people with psychosis or bipolar disorders, in particular, experienced pressure to take neuroleptics or antipsychotic drugs, and that they experienced that there were no real alternatives or opportunities for other kinds of treatment to help reduce it. And they felt that there was no inpatient services in Norway available in the mental hospitals, and that this should be available. That was the goal of the user organization. And they wanted that services where people were not subject to compulsory medication or pressure to take medication, and where the basic of the treatment was a safe place to be, and together also experience to develop good treatment cultures for non-drug treatment that could strengthen this field, because there's not a lot of in this field we need more knowledge. Was the idea in Norway. So the unit that me and Stian work in, it opened up in January in 2017, 2 years after this, the ministry sent out this document demanding the health trust in Norway to open up medication-free treatment. And the debate that followed this law was very interesting to follow. It was a big debate. When the medication-free treatment was getting started in Norway, I think the debate initially appeared to be very polarized on different opinions about what the best treatment for serious mental illness should be. Some thought that medication-free treatment was very unjustifiable. Well, experimental and thoughtless. But with time, after the units opened up several places in Norway, I think gradually there was a growing acceptance that there is evidence for different treatment approaches. And that the introduction of medication-free treatment options primarily concerned a patient's right to autonomy, participation in treatment, and to choosing over their own rights. So a lot of people feel that medication-free treatment is maybe more about human rights and user participation and the right to make choices about one's own treatment than about the effect of different treatment approaches.
Yes.
But I think that the history is important to take in, and it shows that the user organization and the user voice in Norway is quite powerful, maybe.
I think, yes.
All right.
They have been listened to, and they have respect, and they come together and make one strong voice. So now user organizations and users have much to say, both in establishing and systems and in the contact with patients and how they can create a treatment. So, yes.
For the last years, I think the user voice, they have more and more power, both in an organizational structure but also as a patient. Yeah. Now we talked a little bit about why we have medication-free treatment in Norway. I think that many people from other countries contact us and want to hear about it. And what is interesting for many is how did this become an opportunity in one country that medication-free treatment is offered in public hospitals. Yeah, so we understand that is quite something to notice. Yeah. So in the northern part of Norway, north of Norway, we are the only hospital unit that is have a specialized medication-free treatment. So every patient that comes here wants to have that kind of treatment program. Yes. But I think it's important to say that the medication-free treatment, it does not only happen here at the unit, north of Norway is quite large. It takes several hours to take an airplane from one side to the other. So it's a big geographic area with several, quite big cities. But so that the treatment is organized as a treatment process, where what happens in the unit is one little part of the process. People who come here, they are referred from local specialized health services, and the treatment is a collaboration in a network between the patient himself and us and other local health services and the patient's private network, or a part of the community that the patient lives in. Like they said in the conference before, was that life is the arena, not the clinic. I thought that was a very good saying. And the treatment process is organized so that we think that trying to manage life without medication, it can be hard and a long process. So it's important that people who come into the treatment process don't stay a lot in the hospital. So most of the time they are at home in the local community, working with their support network there, but have planned inpatient sessions for maybe 2 weeks, where they come to Tromsø and to the unit and work on what they are focusing on at that time. But often we have contact with people for several years, but during those years, people for the most stay home. Yeah.
Of course, there are differences, because for some persons or patients, it's not so difficult to do this process, to tapping down and try to get a new life and understand things. But for other patients, it can be very difficult to tapping down, and the voices and the hallucinations and the problems in relations come very strong back. So for those patients or persons, it's very difficult, and they need to stay with us more, and we both here at the unit and more connection when they are home, because the patients who had, or the persons that is most ill, the relationship they get to us means something, because we are the people who meet them on this dream, or this that they want to tapping down. Many others who don't want to help them with that. So when we do that, we get important in their lives. So the challenge can then be, how can we take this home to them in the home place, and how can we collaborate with the health system at home, because there are differences for the patients. Yes. So.
I think that the people who have come here as patients, they have the same experience as the user organizations have highlighted. Many have experienced that they would like treatment, but not with medications, and have not been met on that. And many have worked very hard to get a referral to this unit, and find it not easy or easy coming. So I think you're right, Stian, that many feel that we become very important in that, making a choice for their treatment process. the recovery process. Maybe the right word.
Yes. Yes.
All right. Should we talk a bit about what happens in the unit?
Yes, we can.
Yeah.
Yes. Yes.
Do you want to do it or?
What's happened in the unit? Yes. I think this is some treatment. When you get neuroleptics, you get this medication, and that's the treatment, and that's maybe some passive treatment, because you get the medication and that's it. But you should do medication-free treatment. It's more activity. You need to want to or try to get in dialogue or activity or group or relation to other people. So it's kind of very different approaches. But in the same time, many of the patients are both using neuroleptics and tapering down, and at the same time try to get back in their recovery or life processes with activity and meaning and dialogue and being in relation to other people. And that we see is that the timing of the tapering down can be, it's smart to have some stability around that you are living maybe at the same place and you have the same relations, and you're not doing so many other changes in life at the same time, because the changing inside of you, when you take the tapering down, reducing of medication, do something, makes it difficult. So if you both have this changing inside of you and outside, it can be too much. So that we try to talk about before the treatment started, and we try to get this understanding of that. And when people should apply for this treatment, they should be staying at home, living in their home, and write their own reference of why they want medication-free treatment, and do it together with the helpers at the home place. That's a very important thing. It's located home, and it started at the home places.
And I think that's we learned over these years that it's very important. Also because when this idea of medication-free treatment maybe starts in a person in a small city in Norway, and that person talks to their therapist about it in their local community, talk about this idea or this wish of this kind of treatment, and maybe they are using neuroleptics at the time, but want to find out how can I taper down on the neuroleptics, and how can I have another kind of treatment program, or how can this recovery process happen without these neuroleptics. There are many different reasons for the people who come here to want to try a treatment program without neuroleptics. Those who have effect, they don't want to come here. So a lot of people have effect, but we don't see them. So those who come here, I think that they have either not having the effect that they wanted from the medication, or they have experienced very negative side effects that they feel are hinders for the recovery process. So that's the main reasons, I think, that people want to try another kind of treatment. But when this idea is born, and the person, and maybe some of the network around the person start talking about it, and then they invite more people in the process, and after a while we are invited into the process. Some of the things I think is very essential happens, and that is that togetherness in the recovery project occurs, where people that are important to each other in some way come together and work together with something, about something. And I think that's so much power in that togetherness, and also makes it maybe not so scary to try, not for the person himself, but also for those around. They know that we are together in this and we have each other. And I think that maybe also that's something that happens here in the unit, because we have 6 places here in the unit, and all the people who are here as patients, they work together in a lot of groups. And I think that that togetherness that also occurs in those groups with the people who work here. So being together with other people who are interested in the same and having a dialogue about it over some time in different places is very important in what these processes are about.
Many of our patients say that sharing this experience to other patients are very important, and they learn very much about it, and feeling this being together, not alone with their histories and experiences. So, and at the same time, for some patients, it takes a lot of time to feel this safetyness, or to try to be together with others. They use pretty long time, but it's so. But we also see that for some patients, when the medication go lower, it's easier or they want more to be together with others. So there is some similarities there. Yes.
Yes.
I think it's Jens Stelbrink Beckman. It's some voice from you, I think, or is it? Yes, and it's an open unit. There's no cursing. We are prioritizing patients with psychosis or bipolar disorders. 6 places, yes, in Tromsø. Refused from the special health service, local, and there must not be, or drug addiction must not be a main problem.
And that, I think that's linked to what you said earlier about what's a good timing for medication-free treatment. And I think it's also important for those who haven't heard of this unit before, the timing aspect of it. A lot of almost everyone who is patients here, they have a lot of experience with medication treatment. They have tried medication treatment, neuroleptics, antipsychotic for maybe all their adult life. So that's been the main treatment alternative before referral to medication-free treatment unit.
Yes.
And to start off, a large part of the patients, they want to tapering down on the neuroleptics, and they want us to join that process.
Yes.
And concerning the timing issue,
Yes.
we think it's important to have stability when starting tapering down. It's a good, we have experienced that it's a good thing to think about.
Yes.
Before starting off. And we will not define what is a good timing, but we will have a dialogue together with the one who is the patient and the network around, so that everyone can join in the dialogue and the process in thinking about what's the good timing.
Yes.
And also, I think that's when I say that, that's also how the treatment process is planned. I think we at the unit, we try not to make a system that each patient has to fit into, but the treatment is something that develops in the dialogue between everyone in the network. So we try to fit to what is important to each and every patient. We try that. We do that quite a lot.
Okay, let's see. What's the next one?
What's the next one?
Yes. Maybe the same things we were talking about.
Mm-hmm. Yeah.
Yes.
Mm-hmm.
Tapering down over time. Cycle score program. Yes, I think. Try this one.
We can move on.
Oh.
Well, this is a little bit overview about what happens inside a unit when people are here. So we have different kind of groups.
Yes.
And I think that I don't think Stian will have time to go in and talk about every group, but I think of it as different arenas to explore, have dialogue,
Yes.
give support, get support,
Yes.
try out different things together with other in the same situation, and also the one who works there. And we have very we talk it not in a disease or mental illness way, but a human way. Like this is something that everyone can recognize from their own life. And I think that often what is the theme in the different groups is not schizophrenia symptoms or how to deal with bipolar disorder. It's the common human feelings.
Yes.
That we all can experience and say something about and have dialogue about. So just to be clear, the inclusion criteria for the unit is psychotic disorder or bipolar disorder, but we try not to have focus on diagnosis at all when people are here, but to try to meet the user organization's wish for this group who normally has treatment with neuroleptics. That's why we have the diagnostic criteria to have
Yes.
a treatment.
Yes. It's also the structure of the day, and many patients say that that's important. To get up, to have a program, and when they get home, they try to have the same. They eat breakfast and lunch, and they have to get the structure of the day, and that's important for many patients to get an opportunity to try and get up, and if there is some meaningful things to do around the day. So that's also an important thing we can help with. Yes.
And this is a treatment program, but we like to do stuff without outside this to do things together. So we have we try to have a good environment and do a lot of stuff together.
Yes.
In a couple of weeks, we will have our yearly music festival going on, and everyone who wants have participated in making it happen. So having good experiences together, I think we are also important to us.
Mm-hmm.
Okay, so just a little bit about numbers and statistics. Who are the patients at the unit? First of all, I want to say that we get a lot of questions about research. So there's a follow research project going on, but it's not published anything from it yet. So there's a researcher who has interviewed patients here that has been patients here for the past years, and also professionals working working at the unit, and professionals who have worked outside the unit but had something to do with us. So we're very excited and looking forward to some research results after a while. And, yeah. But we can say something about who has been patients here for the past 5.5 years.
Yes.
So about a little bit over 100 different people have come to the unit for treatment processes. There are a little bit more women than men, and the age is everyone is above 18, but most is between 20 and 50. And two-thirds have a psychotic disorder, mostly schizophrenia, and the other part, 1/3, have bipolar disorder. And everyone, 99.9%, have had mainly they have had a lot of medication treatment before they come here. I think 1 or 2 of those 100 have not had medication treatment before they come to the unit. And most of these 100 have, when they come to the unit, they have tried one or several different kinds of antipsychotic medication or neuroleptics before they come here. And it have not had the effect that they hoped, or severe side effects. It's a big variation in how long the treatment process, the contact with our unit takes, from 1 day to 4 years. And I think that shows that these are the people who come here. They have a lot of psychological pain, and it's very demanding. It's very a demanding process to find a way in that, with or without medication. And in some ways, it's more like a life process than a healing from a disorder, I think. About half of the people who come here, they are actively using medication, neuroleptics, when they are referred here, and they want to start tapering down on that neuroleptics. And the other half who are not actively using neuroleptics, they have quit the medication themselves before referred to the unit. And we recommend to use very long time to taper down. So for some, for example, if one person is using 3 different kinds of neuroleptics when they start their contact with us, it might take several years. Many people wonder, is it a success? What do the people say? And I think the most important message that I have learned from the people who came here as a patient is that it's so important that choice exists, that the possibility of making a choice and trying it out exists. And also, I've learned that it's a difficult process. With or without medication, it's difficult to manage, to find a way. But I remember one that said that trying to manage all this psychological pain without medication, it's very painful, but it's so meaningful that I can take it. And people are very motivated, I think, to work and manage without medication. They say that when they use neuroleptics, they are not available for themselves with their thoughts and feelings. So they welcome the feelings that comes when the medications are tapering down, and the thoughts, even though it's difficult and sometimes very painful. They say that neuroleptics, it reduces the psychosis, but it does not heal. And the people who come here, I think they want to work on the healing part, and they need it to be present to work with it. Yeah. Yeah. Yeah.
There is about 15 minutes left.
All right. Yeah.
Here's something about recovery perspective, which one of our perspective we use. That's probably something about individual and social processes. Focus on the opportunities. Yes, see the whole person, not the diagnosis, and it is rather being in recovery than being recovered. Yes, and the other perspective is the relationship and network perspective. We have said many things about that. That's how we work and how we try to get a meaningful or safe treatment process for our patients. Here's some thoughts about, we're trying to get a dialogue with our patients and the process. So we invite our patients to dialogue from the first second of the treatment process. And the dialogue that's based on patients' premises. That's very important, that this is starting at home. When they're saying something about why would you try medication-free treatment. But we're still trying to learn what's important to listen to. What our patients really think is important in their lives and recovery processes. And this is something that's changing through the process and dialogue. We also try to talk about the mental health problems in an everyday way and using a language that the patients understands in order to achieve as much common understanding as possible of the situations the patients find themselves in. So that's something about how we try to get in dialogue from the beginning and how we do it. We meet people with and in their everyday lives, not just patients and diagnosis. We try to meet the human beings. We try to find the patient's interests, resources, goals, and dreams in dialogue and experiencing together. We share experiences, we try to create new experience together, and we try to achieve and give our patients an experience of being together, that we are together about this, in this.
And that's important, I think, or just to say that meeting people with and in their everyday life, just not as patients, that's quite a challenge because we're located in the middle of a big hospital. So our neighbors are the acute units, but we have experienced that it's important that we are here and we try to be something different in a system. But we're also we also think it's important not to be too different, because we want to have an effect on the system. We want to challenge the system, but we are in a hospital, and so we want to challenge those things in the everyday hospital life. How can we meet patients not as patients in a hospital, an old hospital with a lot of traditional settings? Yeah.
I think that we do that is why we can get this dialogue going on or starting with our patient, because it's so much easier to talk about life, about how they feel in an everyday way, than starting to talk about the sickness or what's wrong, or in that diagnosis you should be, or you are so and so. So it's pretty natural, and I don't think it's not about trying to be different. I think it's just to be trying to be a human being in the meeting with other human beings, and trying to talk in a natural way with compassion, and trying to get good meetings between people. I think that's something that could start something, a process, and a dialogue that can go on both here in the unit and at the home places.
Yeah.
So I just watching if we should have some questions, we have that time.
Yes, we should have some questions.
Here is something about promoting equity, and yes, that we collaborate on the treatment plans and the course of treatment, and that we do this together with our patients. Here are some pictures, the view, the rooms for our patients. Yeah, some piano and stuff, the art therapy room, and Goethe.
Yeah, Goethe.
Goethe.
Yeah, a place to have a bonfire and nice time.
Yes. And here is some places to get information.